Hydrocephalus. Hydrocephalus is a condition wherein excess of cerebral spinal fluid, that is CSF, accumulates within the ventricular system of the brain, leading to increased intracranial pressure, that is ICP. Causes of hydrocephalus. The first one is increased production of CSF, which is seen in choroid plexus papilloma or carcinoma. The second one is ependymoma, which is a tumor of the central nervous system arising from the ependyma, obstructing lesion, for example, the posterior fossa tumor or colloid cyst. The other cause is due to decreased absorption, which is seen in venous sinus occlusions, vein of Galen malformations, developmental anomalies like craniostenosis, where the sutures of the skull in an infant close too early, with malformations of the skull base, which can lead to development of hydrocephalus, absence or disease of the arachnoidal villi. CSF production and absorption. The choroid plexus produces 70 to 80% of CSF. Then we have the ependyma and the brain parenchyma. Cerebral perfusion pressure and intracranial pressure are independent of CSF production. CSF is produced at the rate of 0.33 ml per minute, that is approximately 500 ml per day. The total volume of CSF varies with age. In adults is 100 to 150 ml, of which 15 to 25 ml is contained within the ventricles. The arachnoid villi and granulations contribute to the maximum absorption. Now let's see the CSF pathway. The CSF moves from the lateral ventricle into the third ventricle through the foramen of Monro, from the third ventricle to the fourth ventricle via the aqueduct of Sylvius. From the fourth ventricle, it moves into the subarachnoid space via the foramen of Luschka and the foramen of Magendie. So this is the lateral ventricle, the third ventricle, and the fourth ventricle. Clinical features. Prior to closure of the cranial sutures and obliteration of the fontanelle, hydrocephalus results in disproportionate head growth. In the first 2 to 3 years of life, measurement of the occipitofrontal circumference and plotting this on a centile chart should be done. Symptoms include general irritability, poor feeding, slow attainment of milestones. Signs include increase in the head size, bulging of the fontanelle, separation of the cranial sutures, prominent scalp veins, sun-setting appearance of the eyes. Classical symptoms include complex of raised ICP, headache, vomiting, and drowsiness. This is the diagram of the sun setting sign seen in hydrocephalus. The other features forms the Cushing triad, which includes bradycardia, hypertension, irregular respiration. In older children and adults, where hydrocephalus has developed insidiously, cognitive impairment, poor concentration, and behavioral changes occur. Visual obscurations and papilledema is seen. Investigations of hydrocephalus includes ultrasound, X-ray, where you see sutural separation, craniolacunae, flat anterior cranial fossa, and thinning of vault bones. On CT scan or MRI, there is enlargement of the temporal horns of the lateral ventricles and enlargement of the third ventricle. Along with that, there is obliteration of the basal cisterns and effacement of the cortical sulci and periventricular lucency. Treatment for hydrocephalus. Medical treatment includes osmotic diuresis and carbonic anhydrase inhibitor. Carbonic anhydrase is present in the choroid plexus and is necessary for the formation of CSF. However, the effects are not sustained and hence it is useful only in benign intracranial hypertension or as a temporary measure in post-hemorrhagic hydrocephalus. Other measures include bypassing the site of obstruction to CSF flow by diverting the CSF from the ventricular cavity to a site where it is readily absorbed, either through shunt or by endoscopic third ventriculostomy. Shunt surgery includes the fixed valves and the programmable valves. The fixed valves include the low, medium, and the high pressure valves. The pressure gradient across the valve is the difference between the intraventricular pressure and the intra-abdominal pressure in the supine position. Posture, gravity, and the hydrostatic pressure can alter the differential pressures. Anti-siphon device is a siphon-controlled device that houses a mobile membrane that prevents over-drainage. The peritoneal cavity is the most common. The right atrium, the pleural cavity, and the gallbladder are alternative sites. Shunt surgery complications. Mechanical complications include shunt blockage, disconnection, migration, and shortening of the length. Flow related complications include subdural hematoma, extradural hemorrhage, low pressure headaches, secondary craniostenosis, cranial deformity, asymmetrical drainage can lead to trapping or isolation of a part of a ventricular system. The third complication is absorption related, which includes intra-abdominal fluid collections, loculations and hydrocele and perforation of the stomach. Shunt infections include pyrexia, meningismus, irritability, and lack of well-being. Endoscopic treatment. We have endoscopic third ventriculostomy for aqueductal stenosis, septostomy, extirpation of choroid plexus, removal of parasitic cysts, removal of migrated shunts and arachnoid cysts. In normal pressure hydrocephalus, you see gait deterioration, dementia, and urinary incontinence. Radiology shows enlarged ventricles may be secondary to infection or hemorrhage. ICP related symptoms may not be evident. Shunt surgery is advised. Let's see the intellectual outcome in individuals who have hydrocephalus. IQ was found to be normal, which is more than 75 patients with a cortical mantle of more than 3 cm. Social and adaptive functions improvement correlated with increase in the right frontal cortical mantle. Language development was related to increase in the left frontal and the parietal cortical mantle. The motor development was related to both the cortical mantles.